Hi, everyone. Welcome to Facebook Live. I'm David Olajars, Manager of Media Relations at Henry Ford Health System. For today's discussion, we are exploring the important and pivotal role that rehabilitation plays in helping patients in their recovery from COVID. We also hope to shine a spotlight on this specialized level of care and the healthcare heroes who provide this care. Before we get started, a couple of reminders. First, don't forget to read the disclaimer at the top of this thread. Also, for those watching live, we encourage you to submit a question related to today's topic. We'll try to get to as many questions as possible. With that, I'm pleased to introduce our two experts who have decades of experience and are highly regarded in their field of expertise. Romina Bello is a physical therapist and coordinator of Henry Ford's early rehab critical care program. She specializes in treating patients in the intensive care unit to reduce their pain and restore their mobility and overall function. Priti George is also a physical therapist and the clinical counsel chair of rehab services at Henry Ford. She cares for patients who require rehab in the outpatient setting once they leave the hospital. Welcome to you both.
Thank you.
So November marks the 20th month of this pandemic, and we want to remind our audience that COVID still remains a serious threat in our community. In the last 2 weeks, cases are up 29% and hospitalizations are up 14%. Across the state of Michigan. If you haven't yet been vaccinated, we encourage you to do so. There's plenty of vaccine available. And if you're eligible for a booster, we encourage you to get that booster as well. As we have learned throughout the pandemic, COVID can have a debilitating effect on people. Simple things we take for granted, like breathing and walking, can be a struggle for some. It's also been well documented that patients treated in the ICU have impairments in physical function that can last for months, even longer. To begin our discussion, I'd like to turn to Romina and Priti and ask them each to briefly describe your individual roles in treating COVID patients and what that has been like for you. Romina, would you like to start it off?
Yeah, thank you for having me. Our approach in the ICU is really multifaceted. Obviously, as physical and occupational therapists, we are there to restore function for our patients in the presence of strength deficits, balance issues, an inability to walk or perform those daily life skills that we often take for granted, such as getting dressed and being able to prepare a meal for yourself. With our COVID patients, we really have had to be very specific in how we titrate our activity. They often cannot tolerate a lot of activity. And so we are there to not only improve their level of function, but we also have to offer suggestions to those patients and the care providers that are there at the bedside in ways to position these patients to prevent these deficits from occurring. They may not be appropriate for the out-of-bed mobility that therapy is there to provide, but we can offer tips to the nurses about the positioning. How do we protect this patient's joints and the flexibility in their muscles in prep for when it's time for them to get out of bed? Once we start working with them, part of my role is to find a balance between being their cheerleader and kind of like a drill sergeant. I have patients tell me all the time, don't let me tell you no. I know this is the best thing for me. And so when they make even the slightest bit of progress, you will see us as therapists jumping at the bedside and cheering them on and saying, look, you couldn't do this yesterday, but you did it today. And that is progress in this environment. And then the other part is saying, you know what, you have one more trial to stand with us. You can do this. I know you're tired, but you have to do this. So there's a definite multifaceted approach in what we're doing for these patients, and we want to make their hospitalization as humanizing as we can for them.
Priti, because you specialize in outpatient physical therapy, I would imagine that your role is a little bit different from Ramina's, right? But similarities nonetheless, right?
Yeah, that's very true. So our function is similar, but we are entering the patient's recovery in different stages of their recovery. So as Romina mentioned, it's about physical function, how we can maximize their physical abilities. As the patients are recovering with their disease, as they come to outpatient, our role is basically to see how well we can integrate these patients back to the society, back to their everyday life, and what they actually really love to do and perform in everyday function. So our role being kind of similar, but we are kind of really working towards maximizing their physical strength, the endurance, getting their breathing patterns back into normalcy, not only looking at their physical aspect, but also their mental health. Are they biosocially and psychologically getting uplifted as they're getting their life under control and they're getting that empowerment back?
And Priti, speaking from a more broad perspective, how does rehab make a difference in a patient's recovery from COVID?
So rehab, in my view, is huge. It is a part of multidisciplinary care as the patient goes through. The patient with especially long COVID, as they are recovering, they are having multiple mental, physical, psychological issues along with physical disabilities. Physical therapy really plays and ties in well together. As the patients are not able to perform, and these patients we are talking about who were very healthy before they got COVID. So we are talking like crashed down physical abilities, and you can only imagine how much mental and emotional turmoil they might be going through. So physical therapy not only looks at the physical aspect of it, we are also kind of being a cheerleader, a positive coach, and a guide throughout the process of their recovery as they are getting integrated back to the society.
Romina, let's talk about the challenges that you and your team face, caring for patients in the ICU. And how does that compare then to other patients that you care for in the ICU?
Yeah, definitely the amount of PPE that we have to wear with these patients is definitely a challenge for us. We're going into the ICU, and these patients are extremely sick, and we're asking them to trust us to get them moving. And behind the mask, behind the face shields, it's hard to portray that compassion. And so we have to find other ways to do it, whether that's placing, a hand on their shoulder and letting them know that we're going to keep you safe. We've talked with your doctors. We're here to help you. We're trying to minimize long-term effects of this hospitalization for you and this disease process. But it definitely makes it challenging. You feel like you are oftentimes shouting through the mask so that they can hear you. For our patients who are on ventilators, they can't communicate back with us when we are talking with them. And so we try to talk with them as if they weren't on a ventilator and incorporate them into their treatment plan. But that makes it hard. They're looking for our facial expressions to really feel safe in our care. And so the PPE has definitely been a barrier, on top of having to titrate the activities so extensively when we're working with these patients, because they just can't tolerate a lot.
In your experience, Romina, has COVID been the most challenging for you?
Yeah, by far. This disease process has the ability to affect multiple organ systems. And so there's no two patients that have been exactly alike. We have patients where it's primarily affecting their respiratory system. And so a lot of our treatments are working on building endurance and restoring their activity tolerance. In the first surge, we were seeing a lot of elderly patients come in, and they didn't have these very active life roles necessarily. But by the time we got to the second surge, we were seeing patients in their 40s and 50s who had been independent prior and were still working, and potentially were the primary provider for their family, and they have this ICU stay that's extensive, and they've had significant medical changes, and they're significantly debilitated, and they can't just survive the hospital stay and return to normal life. They have a new life role that they have to work through and see how that's going to fit into their life outside of the hospital now. And so that's challenging, especially when they're begging for you to help them. And sometimes in those moments, you just can't give them what they need because they're so debilitated and so sick.
Pretty, in the outpatient setting, what have the barriers been like for you then?
Mhm. Yeah, we acknowledged a lot of barriers. Actually, it is not just the physical, mental, and emotional barriers which the patients come with. It's also the barriers of being isolated, taking that family and friend supportive system, which has been taken away because of the pandemic and isolation. So those are the big contributing barriers. As Romina said, these patients were totally independent and pretty self-sufficient. Now they have to depend on their caregivers or their family members for even transportation coming to the clinic. Other barriers are they're just too sick and tired. I mean, they can perform an activity, but the next day they are just wiped out. They have those crashes. So continuously working through those barriers internally and as well as looking at their family has been the major barriers for them.
Pretty fair to say that COVID also has presented you with the most challenging time of your career?
Absolutely. I would say so. Last year, early spring, we started seeing patients coming in outpatient therapy. I mean, it was definitely a challenging time, confusing time for patient as well as the providers. Little was known of the disease. Little was known of how the disease is going to progress, how much involvement the patient is going to have, and what was going to be the prognosis. So it was challenging for patients in terms of anxiety, the fear they would present with, and just not knowing how much they would be able to participate in their everyday life and what would be their family situation. So definitely it had been a challenging time, which really impacted their recovery because they had an additional burden of the fear of unknown.
Pretty, I imagine there was probably some fear on your end as well, right?
Absolutely. And our fears was, are we doing the right thing for the patient? We tried to do the best, whatever knowledge we had, tried to keep ourselves updated as more literature was coming out, trying to identify which patients would benefit from exercise, which patient would actually benefit from rest and pacing, which patients would be, how do they balance the activities as well as the exercise in order to kind of come together to their optimal level. So definitely it was a challenging time, but it was rewarding in the sense we were able to provide and work through with the patients to give them a good quality of life.
Romina, you've talked with us in the past about how people speak of people who die of COVID, right? Or we hear of those cases of exceptional cases of people surviving COVID. Rarely, though, do we hear of those people who are hospitalized and are now not the same person they were before they got infected, right? Can you talk a little bit about that?
Yeah, when we were going through it and you were hearing, these two groups of people, these staggering numbers of deaths, which, we were going into our units every day and definitely seeing that happen. And then you were hearing other conversations about, well, this has a high survival rate. And I'm seeing these patients and I'm thinking, gosh, these patients that aren't able to come off of the ventilator, aren't able to return home, have to go to a long-term care facility to continue with their medical management and hopefully continue rehab. Those people are counted in those survival rates. And so it felt a little bit misleading in terms of, yes, there are a lot of people who are going to have very minimal symptoms and maybe no symptoms at all. But it's hard for us seeing these patients come in and not really being able to identify, why is this patient doing better than this patient? Or, why is this one having all of these negative effects? So we didn't know who was going to respond negatively to having the virus and who wasn't. And so it felt a little hard to take in when you're seeing patients and you're treating patients who really have minimal underlying health conditions, but yet are doing so poorly, and you can't pinpoint why. And so you're hearing, these high percentages of survival, and you're like, God, but there's this whole other piece of the puzzle that we're not talking about, and it's these patients who, they came in walking to the ER and they just weren't feeling well, and now they can barely move their fingers and toes, and they have no family at the bedside because we can't have visitors, and they're missing that piece of encouragement. And it was just something that I felt should be highlighted as a therapist, that it isn't just about survival. It's about, are you going to have the quality of life that you want when you get through this? And I say we work with the best physicians and nurses, and they are there to save your life. And the physical and occupational therapists come in, and their goal is to restore your quality of life. And so you have to be comfortable with what you want that to be. And so, that was hard to not see that piece reflected in some of the things that we were hearing every day.
Romina, what does the data show about the importance of early rehab and how this benefits COVID patients?
Yeah, so really over the last 15 years or so, there's been extensive research done on the importance of mobilizing patients in the ICU and the negative impact of bed rest for these patients. And so in general, the literature shows that the earlier patients start receiving rehab when they're in the ICU, the better chance they have of coming off of the ventilator sooner, getting out of the hospital sooner, having better functional outcomes. And when we first piloted our program, we did it in a small ICU unit, and then over the course of a couple of years, expanded to all of our ICU beds here at the main hospital. And we collected our own data, and we were seeing the same things. Our patients were having higher levels of mobility when they were leaving the ICU because they were getting daily intervention by physical and occupational therapy. They were getting off of the ventilator sooner. We had a range depending on the unit that we were looking at. Ventilator days had decreased anywhere between 15 to up as high as 40% when we looked at the year prior to therapy being implemented in the units. So, it definitely makes a significant impact, and it really improves the patient's overall mental well-being when they're in the ICU, because it really is a bright spot in their day. We try to focus everything on the positive progress that they're making with us.
Romina, you mentioned occupational therapy. Kind of walk us through the difference between physical therapy and occupational therapy and how they augment each other.
Yeah. So we're definitely a team. A lot of times you will see us in there working with the patients together. And the reason is in the ICU, there's definitely a lot more invasive lines that these patients have. And so it helps to have somebody there that can help you manage those things and keep the patient safe. But the other reason is the activity tolerance isn't always where it needs to be for these patients because they're so sick. And so we kind of tag team and look at the two different things that we're looking at as different disciplines and try to maximize those sessions with the patient. So as a physical therapist, I'm looking at those, big activities such as being able to get out of bed, being able to walk, being able to manage stairs. How can the patient regain their independence as it relates to those things? Our occupational therapists are looking at how can this patient perform their daily life skills that they have to do, getting dressed, being able to do things, that we take advantage of, going to the bathroom independently, right? That's one of the first things that patients ask us when we start to mobilize them is, can you get me into a bathroom? Being able to get dressed on your own or prepare a meal if you're feeling hungry. And the other piece that they're looking at too is this cognitive piece. Identifying ICU delirium early on so they can provide cognitive retraining and treatment to help that patient have better outcomes when they leave us from the ICU. So we look at strength balance and cognition from both of our disciplines, but the way we apply those to the skills we're trying to retrain is a little different.
Priti, there's a term in medicine called post-intensive care syndrome. What is this and how do you help patients address it?
Sure. So that's a good question. So post-intensive care syndrome is basically when the patient stays in the hospital, spends a good amount of time in the ICU, and they're critically ill, severely ill. They have been given a good amount of medication to help survive the ICU stay. So these patients, when they go home, they develop new or even worsening symptoms. And these symptoms could range from as simple as muscle weakness, extreme fatigue, dizziness, headaches, body ache, myalgia, and there's a host of other symptoms which they can either present as a new symptom or as a worsening symptoms. So the other aspect which we have to kind of see is the other three aspect in their life which these patients might have deficit in. Not only the physical, but the cognition part of it. They have something called brain fog or inability to concentrate fully, and the memory deficits. And the other aspect which these patients might have is emotional or mental health issues, increased anxiety, increased depression, or even post-traumatic syndrome kind of presentation.
Priti, after patients leave the hospital, we know many of them struggle, with these everyday tasks that, are part of our everyday life, right? What are some of the common reasons that patients need rehab once they leave the hospital?
So depending on how much time they have spent in the hospital, definitely as Romina talked about, the early rehab program definitely helps them. But some patients will have ongoing symptoms. They would have some myalgic kind of presentation or post-exercise myalgia, which is they perform an activity or an exercise, and then they go through extreme bouts of fatigue and which they are not able to perform their even daily tasks. The other aspects which we usually see is just tightness all over. They are not able to move their arms and legs as efficiently and functionally they would prior to the hospital stay. The other aspect which we see is short of breath, which is if they have a lot of pulmonary involvement, they are struggling to breathe. We see that either they hyperventilate or they just have a very shallow breathing. So breathing problem, physical deficits like muscle weakness, tightness, pain, a decreased activity tolerance, those are the main things which we see in our outpatient setting.
And Priti, when you're rehabbing these patients, is the therapy any different for COVID than it is for other medical conditions?
Yeah, so that's we always kind of look at what's the condition the patient is presenting at, and COVID patient definitely it's a multi-organ. Has a multi-organ presentation, and we see the regular standard way of approaching is pretty much not applicable to COVID patients. So physical therapy, when the patient comes into the clinic, we really discern, is the patient gonna be having the regular route of therapy, or they have something called a long COVID syndrome where they have a post-exercise malaise. So we try to discern where the fatigue is coming from. Is it just from general activity, or it's really activity-induced extreme fatigue? So the way therapy goes for these long haulers or long COVID patient would be a little different route. It would be more of education. It would be more of teaching the patient how they can identify the fatigue source, how they can manage it, and how do we control the patient's breathing, and how do we emphasize that breathing is actually most beneficial for energy conservation in order to maximize their function.
Romina, for patients you care for in the hospital, is the protocol any different for COVID patients than other patients in the ICU?
It's different in, we have to take into account we take into account the medical course that these patients have gone through with all of our patients. But with our COVID patients, we have to recognize that they have little to no reserve in terms of pulmonary function if they're, having significant pulmonary involvement. We also may be dealing with a patient who has kidney involvement and may be requiring dialysis. And so that activity really has to be customized to what that patient needs. We have plenty of patients who actually move around fairly well and aren't needing a lot of physical assist, but they are on significant amounts of oxygen and they can barely tolerate taking 3 steps to get from the bed to the chair without dropping their oxygen sats, having to have us layer more oxygen on them to just try to keep those sats at an acceptable level. Or having to take a significant rest break. So for a lot of patients, getting up to the chair is a full day's worth of activity for them, and it's enough to wipe them out. And so we have to understand that given all of those things, we may not be able to push that patient like we would somebody else who maybe comes in with a respiratory issue, but has a little bit more reserve in their lung tissue than our COVID patients are showing us.
I would imagine having patience is important in what you guys do, right?
Yeah, absolutely.
So for those on life support, Romina, can somebody receive both physical and occupational therapy?
Yeah, absolutely. So life support, in the ICU kind of encompasses a whole lot of stuff. It can be the patient on the ventilator. It can be a patient who's requiring advanced circulatory support, more from a cardiac standpoint. And it can also be a patient who is just requiring certain medication that really is also sustaining life. And we can work with all of those patient populations. The key is to understand what they've gone through medically, understand what they've come in here with, and really discussing with the medical team. We round with our physicians every morning on our patients so that we can determine who's medically appropriate, who has stabilized and is ready for therapy. And there really is little downtime. Our goal is that we make contact with those patients 12 to 24 hours after the physician gives us clearance that patient is medically stable. And for the majority of our patients, it's probably closer to that 12-hour mark of when they become medically stable. And so that communication with the medical team is key in making sure that we are maximizing safety for these patients. Going in and seeing a patient who's on a ventilator, it can be scary for the patient. And so we need to make sure that we can make them feel safe in what we're asking them to do.
Can you walk us through how you help patients learn how to breathe again?
Yeah, so it can vary depending on what is going on with the patient. So our ventilated patients, it might be a little trickier to get them to understand what we're asking them to do. So we use our hands a lot and put our hands on their rib cage and on their diaphragm. And if they are able to follow us enough, and I say that because a lot of our ICU patients require sedation to keep them safe from pulling lines and tubes out, or even just to help with their breathing patterns when they're on the ventilator. And so we'll use our hands, though, to give them kind of a tactile cue and ask them, try to breathe into our hands, try to get a deep breath. Part of the issue that we see with our COVID patients is that they can't take that deep breath. But if we can focus and guide their breathing into a specific location and target a specific area of their lung that we're trying to get them to expand, sometimes that hand placement is enough to help. For some of our higher level patients that aren't on the ventilator, we can use various techniques. We're very creative in the hospital. We don't have access to a ton of equipment. And so oftentimes we have to use what we have at the bedside. So something as silly, if you think back to when you were a kid and filling up a cup of water and having the patient blow bubbles into the water through a straw, and getting them to take a deep breath in, blow through that straw and keep blowing bubbles for as long as they can, that's all strengthening that lung tissue. And so we will do things like that to help retrain breathing and increase lung strength.
And how common is it for you guys to help these patients get out of bed and start walking?
Yeah, it's very common. I will tell you the one piece that is different in terms of walking a ventilated patient with COVID, they just don't have the tolerance to the activity to do that. It's few and far between with our COVID patients right now. Pre-COVID, it was not unusual to have us walking patients on the ventilator fairly regularly. Sometimes that might have meant that we were just walking in the room and getting the patient over to their bedside window so they could look outside and get a little sunshine on their face. Sometimes that meant that we were coordinating with our respiratory therapy team and our nursing staff and getting the patient out into the hallway and walking around the unit. And those were, great moments for us because you would have physicians and nurses lining the hallways cheering those patients on. So unfortunately, we don't see that as regularly with our COVID patients. They're definitely not getting into the hallway because of infection control. And keeping everybody safe, but they just don't have that activity tolerance. So if we are getting a COVID patient who's on a ventilator to a chair, we consider that a success.
Priti, from the patients you have cared for, during the pandemic, is there one that really stands out in your mind, based on the therapy that you have worked with them?
Sure. Actually, multiple patients come to my mind, and but one particular patient comes to mind, which I saw for quite a period of time, as he had a multiple organ involvement. And this patient spent a good amount of time in the hospital, 50 plus days in the hospital, was ventilated, went through a lot of recovering from the hospital. When we saw him in outpatient, he was very debilitated. And this was a person who was the breadwinner of the family. Just to see that aspect, the psychological, the social, and the physical debilitation and the deconditioning which the patient was coming with. But the good part was the patient was very optimistic, and he really worked with therapy. And the good part was, this patient was seen in clinic, and he had a lot of breathing issues. Henry Ford had put forth a telehealth platform for rehabilitation patient, and this patient could take advantage as a hybrid model, coming in person, and also I would be able to see him at home to give him that rehabilitation so he can take his mask off and he can do the exercises. I can see where his functional needs are to navigate in the house setting, using the stairs, going down to the basement. He had a gym. Okay, what all things, resources which is available in the house, how we can optimize that. And this patient did fairly well. Definitely, this patient was a high involved patient, did have some lingering issues still going on. But it really brings into light how challenging the whole situation of COVID recovery is.
And Priti, there's a level of commitment, though, on the patient's part, right? That's really crucial to them regaining their strength or function, right?
Absolutely.
That old adage is, what you put in is what you get out. Talk a little bit about that.
Absolutely. I mean, there is a huge patient commitment to therapy and recovery part of it, and it doesn't come easy. They have to overcome a multitude of aspects as they are going through this recovery. So the patient not only has to kind of give that positive, take every day as a new day and perform, but we realize that, we acknowledge that. And in therapy, it is not all performing to the optimum. We understand that there are a few days where you don't feel the best. You have those good and bad days. So we work towards with the patient to kind of give that, okay, today is not so good day. Let's kind of try to do things and learn how you can maximize the days where you are feeling extremely fatigued. Yeah, let's concentrate on the breathing, easy exercises where you can still get that empowerment and the sense of control. So absolutely, the patient is in a long haul and need constant positive encouragement, not only from the therapist, from family members and friends circle.
Ramita, for you, is there a patient that comes to mind, for you that really illustrates the role that you have in their recovery?
Yeah, absolutely. Just within the last few months, we had a patient in the ICU who came to us airlifted here, was not doing well. Everything that could have been thrown at him was thrown at him. We weren't sure. If you would have asked me back then if I thought he was going to have any type of a positive outcome, I would have told you, you know what, with my years of experience, probably not. He was in my ICU for 35 days before we were able to lay hands on him, which is extremely unusual for the early rehab program. But we rounded with the physician one day, and he said, "You know what? I think today's the day. Let's give it a try." We went in there. We evaluated him. It was the first time he had really been alert throughout his whole hospitalization. He could barely move his fingers and his toes. We saw trace movement in both of those. And myself and the occupational therapist I was with said, "This is it. This is our time. We need to see him every day." And we did just that. And he actually was able to get off of the ventilator fairly quickly, considering he had been on it for over a month. But we worked with him daily. We were able to get him standing within the first week of him waking up and starting to work with us. He was able to have family at this point because he had been taken off of COVID precautions because he had been there so long. But he ended up leaving the hospital walking, and he worked really hard. And it speaks to not only us being there to provide the therapy, but he worked extremely hard. At one point, he didn't have the grip strength in his hand to hold on to a walker or use the back of a chair to stand. And so we balled up a roll of a tape on that chair, and he put his hand on the tape and he just let it stick there so that he could keep it in place in order to achieve a full stand. But he left here walking, and that was with daily therapy and his motivation to do that and return to the life he had before he had COVID. And when he first woke up and got his speaking valve, he looked at me and he said, "How am I ever going to thank you? And when can I get vaccinated?" And I said, "Your recovery is thanks enough, and we will get your physician that you can talk to them about that."
What a great story. Speaking of family and friends, what role do they play in the rehab process? Ramita, you want to go first, and then Priti?
Yeah. So, in the ICU, they play a huge role. They know their loved one the best. We are trying to figure out what does the patient do as a hobby in normal life? What can we incorporate into our treatments to make it feel familiar to them? And sometimes patients don't respond to our voices, but then they hear the voice of a family member and they perk up and they can follow some commands. And so we really utilize family to find out what is it that your loved one needs or did prior to this hospitalization, so that we can incorporate that and make therapy that much more engaging. So we have we've had patients who have been bricklayers, and we would go out and buy models for them to build things and just use that as some cognitive treatment, and also some fine motor work that they could do while they were building models. And so we really pride ourselves in being able to customize our treatments to what's going to keep that patient engaged and make it more meaningful for them.
Priti?
Yeah, so the support of loved ones cannot be underestimated. Initially, when they come to outpatient, it's usually the family member or any caregiver coming, getting in and out of the outpatient therapy. We try to engage them as much as we can. We try to educate them what the patient is going through so they can be a part of their recovery. We encourage patients to kind of open up to their family members, and so they realize what are the ups and downs in everyday life they are facing, not only physically, but emotionally, and how they can kind of have that support from their family when they really need them most. So family members really go a really long ways, long term, for a great support for the patients.
And Priti, can you tell when a patient really hasn't been adhering to their homework assignments, in between your one-on-one sessions with them?
Yeah, PTs can usually tell. Therapists can really quickly discern, like, oh, things have not been going as recommended. But we try not to blame the patient. We try to meet the patient where they are at and find out what are the barriers to not following that home program. Was it they couldn't understand what was asked for them, or was it too difficult, or they had some problem doing that? So we try to meet the patient where they are. And most probably, most certainly what happens is once we talk it out, see, okay, this was expected. Did you have any issues? Since when we spend a good few minutes in there, patient realize that, oh, this is really important for me, important for my recovery, and they start getting more consistent and more compliant with their home program.
So as we close up our discussion today, I wanted to ask each of you for a closing thought or a take-home message for our viewers. Priti, you want to start us off?
Sure. I would like to convey that if you're going through a lot of symptoms of COVID and you have not found yourself to be where you would like to be physically, you're not able to perform your everyday activities, or even if you were a runner or a walker, you're not there yet, please ask for help. There is help available. It is a confusing time and symptoms which produces with COVID, but there's help out there. And I would encourage you to talk to your PCP and see if physical therapy is going to be right for you.
And Romina?
Yeah, absolutely. We always encourage patients, if they are feeling like they just aren't where they were before they ended up in the hospital, or if they are feeling scared about what happened while they were in the ICU and just feeling not like themselves, know that they're not the only ones out there. As Priti said, talk with your primary care physician. There are resources out there. More and more, there's post-ICU support groups for you to talk with. The best advice that I can give to prevent an ICU stay and putting yourself at risk for these complications is to get your vaccines. If you are eligible for the booster, get your booster shot. We just can't say who's going to do well and who's not. We haven't been able to pinpoint that. And so if you can avoid taking that risk, that would be my biggest suggestion. But, talk to your physician if you're feeling any of these things that are, impacting your life and you don't have the quality of life that you would hope for.
This has been a really insightful discussion. And Romina and Priti, I want to thank you for joining us today. We appreciate everything you do for your patients, and we're most grateful.
Thank you.
I also want to thank our viewers for watching. And as we head into the holidays and make plans to spend time with family and friends, we ask that everybody do their part to stay safe. Make sure you get your COVID shot, make sure you get your flu shot. And when you're indoors in large crowds, please wear a mask. For any updates about the vaccines and other COVID-related information, please go to henryford.com. And we'll see you on our next Facebook Live. Have a good afternoon, everybody.